Good evening, everyone, and welcome. Welcome to the third edition of Checking In on You. And today, ladies, we're going to lay it on the table. This evening, we have an exciting program planned for you, and we hope that you enjoy it and that it is impactful and meaningful to you all. We want to start this evening with a presentation, and it's going to be done by Miss Melissa Brayton. She is going to be discussing and sharing with us how you can access services within the SWRHA, which is i.e. the Southwest Regional Health Authority. After that, we will go into the meat of the matter for this evening. So I am going to hand over to Ms. Brayton at this time so that she can present on access to services within the SWRHA.
Good afternoon, everyone. My name is Melissa Brayton, and I'll be presenting today on how to access services within the SWRHA, especially the primary care service. Next slide. Right. So first, I'll just give an overview of who is the SWRHA and what we do. So the Southwest Regional Health Authority is the largest regional health authority which serves a population of more than 600,000 persons. At the SWRHA, we have 31 primary healthcare facilities, which is what we're going to basically be talking about this afternoon. 2 extended care facilities, 3 district health facilities, 2 hospitals, and 1 rehabilitative center. So what is the vision and the mission of the SWRHA? The SWRHA, or the Southwest Regional Health Authority, will become, in the future, a leading provider of compassionate, cost-effective, premium quality care and service to the people of the Southwest region. The mission of SWRHA is basically in the business of promoting wellness and providing cost-effective, customer-focused healthcare to the people of the Southwest region within the guidelines of the national policy and ensuring our staff a productive and rewarding environment. So what is primary healthcare? Primary healthcare is a whole of society approach to health that aims at ensuring the highest possible level of health and well-being and their equitable distribution by focusing on people's needs and as early as possible along the continuum from health promotion and disease prevention to treatment, rehabilitative and palliative care, and as close as feasible to people's everyday environment. This is according to the WHO. So just back to this slide one more. So what does this basically mean to break it down into our terms? Primary healthcare is not just about you or just about us. It's a whole of society approach. And we at primary healthcare basically is you coming in to seek the best possible care from the earliest possible time, and not just when you are at a critical stage, then you come to seek care. But we really want to assist the public with doing health promotions and disease prevention, which is why you access the primary healthcare services and the treatments within primary healthcare. Next slide. So why is primary healthcare important to you? To help spot health problems before they become serious. It is the best way to manage existing health conditions. It's a form of early health intervention. Primary healthcare is basically the gatekeepers or the doorway to access non-emergent healthcare, things that you don't need to go to accident and emergency for. You can do that at primary healthcare. Primary healthcare also provides services for each member of the family. So I know basically sometimes, or not, most of the times, we think that it's just for auntie or uncle or your grandfather, but primary healthcare starts from before birth, which is antenatal care, postnatal care, and we'll see it as we go along with the slides. So what are the services at the primary healthcare facilities within the SWRHA? Health office or walk-in services. At this clinic, which is a clinic, this is where, if you're not sure about where you're at right now within your healthcare, within your health, you can go into any one of the health offices or walk-ins clinic, and they will assess you and let you know what's happening and give you, if it's appointments for where your healthcare is necessary. There's the chronic disease clinic, antenatal and postnatal care. Once you think or you believe that you're pregnant, you should get and access this antenatal care as soon as. There's child health clinic. That clinic is where you carry your kids to get not just vaccination, but you go and you get either it's 6 months or yearly checkups, and to make sure that your kid is okay, and also immunized, not just with the COVID-19 vaccine, but with other vaccination, so that they can enter their schooling and continue to live a healthy lifestyle. At primary healthcare, there's also family planning, and it's not just for females, there's also males can attend this clinic in order to understand and to know how to care for yourself. And family planning is not just to about contraception, but also pap smears. Also for the males, you can also go there to have your different tests and stuff like that done, so that you would be able to know where you are right now in your health, so that you can seek if it's treatment or preventative care. Other services at the SWRHA primary healthcare services are same-day HIV testing that is done at selected health centers, child wellness centers. This is also done at selected health centers. There's dressings, not just if you get minor cuts and bruises, but when you would have had surgery at secondary care, as we will call hospital. When you get discharged after surgeries, you go to the health centers, and that's where you access services where you'll be able to be taught how to change your dressings or how to care for your after surgery care. There's also adult immunization. This is done, like I said, not just COVID-19 vaccination, but there's HPV vaccination. There is also tetanus, and that is something that you have to continuously get every 10 years. So if you have your vaccination card, you can check it and make sure that your vaccines are up to date. There's also pharmacy services. The thing with pharmacy services is that it's throughout all the primary healthcare centers. However, if you have a private prescription, we will not be able to facilitate you. We only facilitate the prescriptions that are issued by an SWRHA institution. Next slide. So when can I, or you might ask yourself, when do I go to a primary healthcare center or a health center for a routine visit once or twice a year for appropriate screening and general review, for any medical health issue that does not require a visit to accident and emergency? Now, for accident and emergency visits, you will go if you have severe chest pains, severe abdominal pain, motor vehicular accidents, gunshot wounds or chop wounds, near drowning experiences, allergic reactions, or asthma attacks. So how to access primary healthcare services? You can walk into any one of our 31 primary healthcare centers Monday to Friday, 8 a.m. to 4 p.m. When you get to any one of the primary healthcare services, if it's not a walk-in service day, the clerks that are there would be able to assist you the qualified and trained DHVs as well as primary healthcare physicians would be able to advise you on and if you should return and when you should return. If before you actually get to the, you can go ahead to the next slide. Before you actually access the primary healthcare services, and like for some of us, for me, don't waste my time. So if you don't want to waste your time, you can always call or contact our customer service center, which is 87 SWRHA or 877-9742, and that's a toll-free number. So even if you don't have money on your phone, you can access that service by calling 877-9742. You can also email customer service at customerservice, all lowercase, at swrha.co.tt, or you can visit any one of the SWRHA's social media pages, Facebook and Instagram, if you want to be updated on any one of the services or anything that is happening throughout or within the SWRHA. And once again, any information that you may require concerning any of the services throughout the SWRHA, you can call 877-9742. And even after listening to this awesome presentation that you're about to hear and participate in, you can give feedback and comments at
Okay, sorry about that. Miss Brayton got cut short just by a little bit, but she was about to say that you can also use those same numbers and that she would have given you to add comments. There are feedback forms at each of our health facilities where you can always give and share your comments. You also can email customer service at swrha.co.tt as well, or you can call 87-SWRHA, which is 877-9742, to give feedback of any kind. So we're on to the meat of the matter for this evening. I'm sure you're seeing some lovely ladies on your screen, and I'm just going to take a moment to introduce all of them. This evening, we have Mrs. Michelle Marie Lafourcade, and she is going to be the moderator today. I call her Lady Extraordinaire. She has worked in public health for over 25 years and is the current General Manager for Policy Planning and Research at the Southwest Regional Health Authority. She has a passion for health promotion, and it is no surprise that she chairs this committee, leading this transformational arm of healthcare, which has made this forum this evening possible. She enjoys outdoor activities like hiking and even conquered the 100 steps climb in Vista Bella. She will guide us through the forum this evening. And now on to our panel. Our first panel member that I'm going to introduce to you is Mrs. Danielle Placid. She considers the counseling room a sacred space where deep heart change occurs. Her warm, collaborative, person-centered approach allows her clients to feel safe while sharing their hurt, their truth, and their pain. She empowers her clients to move beyond just survival to a life where they
I think Dr. Arthur just got frozen there for a little bit in time. So we just try to see if we can reconnect with her, because I know she really wants to introduce all of our panelists who are here this afternoon for our forum. Yes, so she said she's restarting, so she should join us in a couple of minutes, so we can just hold and allow her to restart, so then she can finish this afternoon's, at least the presentations of our panelists this afternoon. We do apologize. We know the pros and cons of being in a technical age. So we're happy to have persons with us virtually, and we're happy that we can all share this virtual space, but we just have the little technical difficulties. I am sure she'll be coming back on at any point in time now. And maybe while we wait, I can also share a bit about Mrs. Placid. And as you see her smiling on the screen there, I would have gotten information from Sandy concerning her educational journey. It includes, so we have somebody here who is versed in family life education, psychology, trauma, grief, mental health behaviors and disorders, post-abortion recovery, human resource management, women and girls empowerment life coaching, theology, and she's pursuing a PhD in psychology. She's also the visionary and founder of the Priceless Foundation for Women, which is an NGO, a non-governmental organization with a mission to educate, empower, and elevate girls and women. She loves cooking, baking, reading, scented candles, so that's one thing we learned about you, and the color yellow. She also loves people. She's a wife to Hazy for 22 years, and together they parent 3 beautiful young adults and are the owners of Safe Place Family Life Enrichment Center Limited. So Ms. Placid, we welcome you this afternoon as one of our panelists.
Good afternoon, everyone. It's my pleasure to sit with these beautiful women this evening.
Yes. Moving on, I'd also like to present Mrs. Cathy Ann Thomas Elborn. Mrs. Thomas Elborn wears many caps. She is a professional, a mother, a wife, a mentor. She has been in the field of nursing for 37 years and is currently the General Manager of Nursing at the Southwest Regional Health Authority. She's also the Public Relations Officer for the Midwifery Association, Publicity Chair for the Omega Kappa, and affiliate of Sigma Tier 2, and presented on menopause in Japan. She has been instrumental in developing programs within the authority related to wellness of women and children. And also, believe it or not, despite all these hats, she does find time to follow her passion as a designer and enjoys outdoors activities. Ms. Thomas Elborn, we welcome you to the forum this afternoon. Dr. Siobhan Hussain. Dr. Hussain is 38 years old and has been employed in the Department of Obstetrics and Gynecology at the Southwest Regional Health Authority for more than 10 years. At present, she is one of the senior specialist medical officers for the San Fernando General Hospital, having completed her postgraduate training internationally and locally. She's a member of the American College of Obstetrics and Gynecology with an interest in further studies in the future. She's a mother of 2 children, ages 7 and 2 years old. Dr. Hussain, welcome to the forum. We now move on to welcome Dr. Anna Nichols. She graduated from St. George's University with an MD in 2019. Since then, she has been working as a house officer at the Southwest Regional Health Authority and is currently assigned to the mass vaccination program. Her drive to become a doctor were the values instilled by her faith and family, She cannot imagine a more fulfilling job than being part of a profession that is focused on facilitating people leading healthier and therefore happier lives. Medicine provides her the opportunity to advocate for those who may not otherwise have a voice. Patients have taught her many of life's most profound lessons through their stories, their struggles, and their triumphs, making the journey of her medical career very worthwhile. She especially enjoys writing and spoken word poems, one of which she will be sharing with us this evening. And this has helped her to cope with the loss of her husband 2.5 years ago. Dr. Nichols enjoys crocheting, trying new foods, and spending time with her family and friends. Dr. Anna Nichols, welcome to the forum this afternoon. I just thought I saw Sandy smiling at me. I guess she didn't come back.
Yes, I am here. I'm back.
Okay, great. Candy, would you like to just welcome our final panelist, Dr. Esther?
Sure, no problem. Dr. Esther SWRHA. She's been a house officer at the Southwest Regional Health Authority since completing her internship in July 2021. She is passionate about health and the education of young women like herself and hopes to share her experiences and views to highlight challenges that women face in the workplace. She is concerned about the many reports of gender-based violence and hopes to be a driving force of change in this area. In her off-duty time, she likes to write and watch Netflix shows, especially those with a murder/mystery or adventure theme. Good evening and welcome to you. Thank you for joining our panel. So you've been introduced to our moderator, who ably stepped in when I had my technical difficulties to introduce the rest of our panel. And we're now going to get into our panel discussion for the evening. It's going to be divided up into 2 sections. After each section, you are going to have your questions addressed. So feel free, even as we're progressing, to write your questions into the chat box, and we will be sure to answer them at the end of each section. So, Michelle, over to you.
Great. Thank you very much, Dr. Arthur. So again, a warm welcome. We are here with an engaging group with our Women's Forum, and we have our hardworking, intellectually packed panelists. So let's get right into discussion. Our first area of focus will look at work and womanhood. And I'd like to throw this question out to firstly, Ms. Thomas Elkhorn. How do you balance career and personal life?
Hi, good afternoon, everyone. So that is a rather tough question that everyone seeks to find, that balance between your professional work life and your home life. But nevertheless, once as a woman, you enter the field of work, it's something that you must do. For want of a better term, to keep you sane, you must be able to balance. And the first thing you have to do is prioritize. And prioritize in the sense of what is important in terms of your professionalism and what is important in terms of maintaining your household. Therefore, you look at quality time, which is important for family life, and you look at the time that you must incorporate into whichever organization you belong in order to meet the efficiency and competency of the office that you hold. So, having said that, what you learn to do is, what are some of the expectations of your household? And even though you are a woman in the field of work, husband, mom, the children still want to know that they can taste mommy's hand, so to speak, as we say in TNT, because they want your cooking. So that chore does not go away. What happens is you usually get assistance from the children as they grow. And in my case, you get assistance from the husband, because just putting it out there, he's an excellent cook, you know? So these are some of the things that we have to look at. And very early in my, if I'm pulling on my experience, very early, we set certain boundaries, or rather we set certain timelines as two professionals within the household who were shift workers. And therefore it was a case of whoever gets home first puts on the pot. Yes? So, and I know for some people, they might be saying, well, some people will try not to get home first at all. But that is what happened. And therefore you found that the strain wasn't only on one individual. Yes? The other thing is you have to learn how to make your life easy, simple in terms of your preparation. And therefore, if you make market, when you come home, you sort of, whether you have to cut up the vegetables, whatever it is you have to do, you make your meal prep, you put them in bags, you put them in the freezer, you portion out the meat, which would be like a family portion. So whenever now you are going to prepare that meal, it's just a case of pulling things out that you know it's going to work for the meal plan, which makes life quicker, makes things easier. In terms of your work, you have timelines to meet. You have certain timelines that you must meet. And therefore, you have to work out how it is I am going to meet with a particular timeline in terms of a report that is expected of me without compromising the time that I would spend with my family. And in this instance, it is a case of making use of the time you have while on the job. Because if you allow yourself to idle, get caught up in needless chatter, you lose ground, you lose important time frame, and therefore you realize that you then run into problems and you have to take work home, which now encompasses or compromises the time that you're supposed to spend with your family. So these are some of the things. I know the other panelists might want to have a little say here, so I will hold up. But these are some of the things that, it's not by any means all of it, but these are some of the things that you can look at in terms of maintaining or striking a balance so that you can achieve both comfortably.
Thank you very much. Very salient points. And we're all familiar with that term, juggling, multitasking. It's sort of synonymous with being mother, wife, baker, economist, barber at times. All right, so thank you very much for those comments, Ms. Elborn. Any of the panelists, feel free also. You can share your expressions at this point in time on the same matter of work-life balance. Before we move on, we'd love to hear from you as well.
Hi, everyone, if I may. Ms. Elborn, you did a fantastic job, but I just want to add a component that we tend to miss out on when we have to do all this juggling. Are you hearing me clearly?
Yes, we are.
Okay, good. Self-compassion, because in the space of having to juggle work and have that balance, what is important, balance looks different for everyone. So, Miss Elbon would have listed out things that she would have done to get that balance in her home. And so it's very important that you think about your world and your context when you're trying to do the balance. Because if you go to line up or use Mrs. Elbon's template, it may not work for you. And so I just want to add the element of two things. Your world, paying attention to your context, and also adding self-compassion, because we can be, truth be told, ladies, we can be hard on ourselves, especially when we check out the neighbor next door and we find the neighbor looking all well put together, and every time you step out of the house, you're looking real hot. Something is wrong, and I mean, we're struggling, so we're talking real. And so we find ourselves peeping through the neighbor door and wondering, but she have 3 children, I have 3. I mean, the household kind of balance, and how I look, and I'm not getting to do my nails. And do not compare your world with somebody else's world. Be kind to yourself and be kind to your environment. And here's what, in all that we do, because balance looks different, always learn to say no without feeling guilty. There is only so much you can do as an individual. So I just wanted to add that in addition to what was said.
Yes, very well said. And exactly, it's not a one size fits all. We appreciate that point. And Mrs. Placid, as we have you on the floor, we'd like to go on to look at, a lot of times society has an expectation of us or puts those expectations on us on a daily basis from time to time. Tell us, how does society expectations affect your actions?
Again, and there's always that external pressure which affects us internally, and society is one. Whenever I work with people and they're struggling with, really just trying to show up well, we always look at what are those triggers, and the external environment, society is one. And so you have to, again, understand if society is forming, and which it did, an expectation for us to show up in the world, always pay attention to what works best for you. And so if you can't meet the expectation, you have to now reevaluate your life. Because if you force yourself to meet an expectation that you can't meet, then you're putting yourself at a disadvantage. And this is where you will fall short of meeting the expectation in the first place. So we may not be able to do anything in totality based on the expectations that society set, but what is important is what can I do with myself in the midst of all of this? And be honest. If you can't meet the expectations, because there will always be the expectations, it will always be there. And guess what? There will be more to come. And so you need to know who you are. You need to know what you can do and can't do. My favorite thing of all, the circle of control. What can I control and what I can't control? So, and that's what I will say on that.
Great, thank you. I love that element of honesty where you said we really need to be honest with ourselves because it's important for us. Any of our panelists would like to weigh in on this matter at this point in time? Okay, great. Dr. Hussain, I'd like just for you to share, being a female in a male-dominated area of specialty, how do you treat with bias in the workplace?
Good evening, everybody. I knew that I would get the hardest question. I just knew it. But we have no male on this panel, and we have no male attendees, do we? I want to know how frank and blunt I can be.
Or we're chatting this evening. We're chatting this evening.
We have a few? Shucks. I remember seeing this meme one time. I'm a big fan of memes, right? And that said that a woman is supposed to work as though she has no children, and she's supposed to take care of her children as though she has no work, right? So I expect when I go to work, I mean, yes, all of the consultants in San Fernando General, except me and myself, were 2 junior consultants, are males. And sometimes I feel like they do not understand what it takes to be a woman. They don't understand the cycles that the woman goes through. And they seem to treat us as the inferior sex, right? And I'm not talking about this in a good way, like the 18th century, where, in England and France, and they hold their little parasol and they go around the park. It's not like that. Israeli is a competitive field, and sometimes it's very difficult for us to see ourselves as an equal, right? I'm not talking about, with respect to the pay grade and all that. Luckily in Trinidad and Tobago, everybody is paid the same amount, and we don't have to go through the stress that some other cultures do. But it is something that you can take very personally, feeling that you may not be as respected as you want to be, even though you may be as qualified in the theory as anybody else. And it's not just from colleagues, I should say, it's also from patients, which I find very disturbing. And this is not to mean anything bad to anybody, but I have had multiple instances when I've gone to counsel a patient, and I would always introduce myself as, "Hello, good day, my name is Dr. Hussein." And at the end of the conversation, they will be like, "Okay, thank you, Nisi." All right, no problem. No problem. So then most of the times I would correct them, but it annoys me greatly when the patients would say, "And when is the doctor coming? I saw him just pass. Is he my doctor?" And I don't know, I think that is a perception for a lot of women that needs to change, and to see women as equal to men. I'm not quite sure when and how that's going to happen, but I hope that it happens in the near future. Because I have a daughter growing up, and I would like for her to not experience the same things that I experience, because nobody talks about it. That's my contribution.
Thanks so much, Dr. Hussein. And again, this forum is about speaking about some of those issues and also moving on to sensitize, the wider public and even our colleagues that, yes, we do work hard. And I love that experience that you shared, where I didn't even know that those things take place, that, a patient would ask, when is their meal doctor coming to treat them. So we want to recognize that, yes, these things do take place within the work environment, but we do cope, and there are mechanisms that we champion in order to overcome a lot of these biases that still exist in the workplace. I don't know if any of our panelists may have a similar experience or wish to share anything with this with respect, especially with the workplace, as all of us are working women. Okay, not at this point.
Yes, I can relate.
Yes, Ms. Elboy?
I said yes, I can relate to what Dr. Hussein has described.
Yes.
And I think it all has to do with culture, norms, perceptions of persons, because it happened in many stratas, many different fields, many different levels within one organization, where, for instance, you might put forward an idea and it would be brushed aside. Somebody else, and when somebody else, a male counterpart, would come and put forward the same idea, probably using different terminology or so, and it would be a wow effect, and then you wonder. So it is something that is not to say uncommon, but at the end of the day, you are the person who has to make your presence felt, and you are the person who has to stand up and be counted. So if you continue to allow it to take root, then you become invisible, and therefore you have to indicate and correct. So patients who mistaking you for the female nurse, you have to state, why would you think that I'm the nurse? Get it out there, and you put it forward to them. I am not the nurse. I am your doctor who is here to look after you. and you put it forward to them. Because it happens vice versa. They look at the male nurse and they think the male nurse is the doctor. So it happens. I have seen it myself as well. But as I said, we need to stand up and be counted, be brazen. So Dr. Hussein, that's your next mission.
And we know she will aptly do it. We know, we hear that conviction and confidence in her voice. And Ms. Albans, thank you for those salient points as well. As we move on now, I would like to focus on now Dr. Esther. And I'd like for you to tell us, have you ever had any challenges? We know sometimes right now, especially self-image, self-esteem, those sort of things, self-worth are very, very important, especially to women. Have you ever had any challenges with self-image or self-esteem, and how did you overcome it? Dr. Esther.
Hi, good afternoon, everybody. Thank you so much for having me today. And to your question, definitely, self-esteem is something I've struggled with for my entire life, as long as I could remember. And I just wanted to go into some points that I think are important. First of all, I would like to just remind everybody what the meaning of self-esteem is, right? It's basically your opinion of yourself. So basically how you see yourself, not how anybody else sees you, but how you see yourself. And when I think about self-esteem, I like to compare my self-esteem to buying my car or having my car, which is a strange concept, but hear me out, okay? So when I first bought my car, the guy told me, okay, well, everything was fine. The car was perfect. There was absolutely nothing wrong with the car. After maybe like a few weeks of driving around, I got a flat tire. So I do what I guess most women would do because we just don't like changing a tire. I asked my boyfriend to change my tire for me. And he was very willing and he changed it and I was back up and running again. A few weeks later, I started to have some problems with my engine. Again, I don't know anything about an engine. So I was like, okay, I asked my brother, I was like, can you fix my engine? He was like, sure, no problem. And he fixed it. Again, my car was back and running. And then a few months down the line, I realized that I was having some problems with my brakes. Finally, I decided, okay, I'm going to try and get this done. I took it to a mechanic. I didn't really know the guy. He looked trustworthy. I was like, okay, cool. Everything is fine. Like, he'll fix it and everything will be good. So my point being is that self-esteem is not something that is created by one situation, but I think it's a multitude of things. And I think when we depend a lot on other people to try to fix our self-esteem and fix our confidence, and sometimes we give our self-esteem to people who are trustworthy and who can help us, but other times we don't get so lucky and then we're put in a situation where somebody doesn't have the best of intentions and then we're left even more broken than before we even started. So I think it's important to identify like the different signs as women of what low self-esteem could look like, because low self-esteem can look different on every person. So think about it. Do you feel anxiety or depression when you have to make a big life decision? Do you not trust yourself? Do you engage in people-pleasing behavior? Don't you reinforce your boundaries when somebody makes you feel insecure, makes you feel endangered? And this is a few things that I actually implemented. I want to preface this with that I have not overcome my self-esteem issues. It's definitely something that I have to work on and I'm working on every day. And these are just some of the things that help me. First of all, spending time with people who make you feel good. I think a lot of times, especially as Dr. Hussein was saying, like in an environment like that where people question your capabilities a lot, you find yourself questioning yourself and you don't have a say with who you work with, your patients or your co-workers, but you do have a choice when you leave the hospital. You do have a choice when you leave work. And you do get to pick your friends and you do get to pick your family. And I think that's an important aspect to life, is picking the right people. And if it's not people, pets are just as good. Secondly, you need to celebrate your accomplishments, whether they're big or small. Sometimes we can get numb to small achievements that we have in our life.
But I think it's important to try to live in the moment and appreciate your small mercies. Thirdly, to remember that everyone makes mistakes. I think it's so important to remember that we're not perfect, that everything we do can't be perfect, and that we need, as you guys were saying before, be a little kinder to yourself. Last but not least, approach new opportunities with the catchphrase ready or not. And this is something that I've really been trying to do recently. Ready or not doesn't mean that you know what you're going to get into, you're not sure what's going to be across that bridge when you reach, but at least being there and being present. And this is definitely very, very scary at first, but when you realize that you can do one thing, sometimes you realize that the other things aren't as bad. And I think that's really important. So I want to thank everybody for listening. I want to pass the mic back over. Thank you guys for listening.
Thank you, Dr. Esther, so much for your candid and yet honest expressions. I like that, ready or not, definitely. Dr. Placid, would you like to share any thoughts with respect to self-image or self-esteem? I see you smiling.
I'm smiling because you call me doctor. I feel so honored. Thank you so much, Esther. Wonderful. So I would add that it's a statement that I like to think about because our self-esteem, as you rightly said, is the way we think about ourselves. So the way we think affects the way we feel, and the way we feel affects the way we behave. And so where our thoughts come from, to affect how we show up in the world, as I would say it. And that would speak to the messages we receive from various places, whether we receive messages, those negative messages from family, society, the media, friends. I will also add, what are those messages you are telling yourself? Because self-esteem is tied to the values and how you see yourself. And of course, your confidence have to deal with your ability to do something. So I'm saying the way you think affects the way you feel, and the way you feel affects the way you behave. So reverse it a bit. So if I'm behaving in a particular way where my esteem is not, on par, then my feelings is not on par. And then what am I thinking about? What is those messages I say to myself, or the messages that I receive and that I believe that is affecting my esteem? And I will say to those who are listening that look at yourself. There's a phrase that I use that someone told me once, because I experienced a lot of self-esteem when I was growing up, name calling, about my eyes, my nose, my weight. When you're in school, people say things about you, right? Yeah. Not just in school, even in the workplace, people would say things about you. You feel it, you hear it wherever you go. And so someone once told me that you have value and you add value. You are loved, so show love. And coming out of my NGO, that your worth is priceless. And so therefore, those affirmations is what you tell yourself. It's not easy to come out of a low self-esteem place sometimes, but it is possible. What do you tell yourself and what you want yourself to know? It's okay, long ago we used to say, don't, you could talk to yourself, but don't answer back. I want to champion. I don't know if anybody ever heard that before, right? Talk to yourself and don't answer back. But I want to say to everybody that talking to yourself is okay, because self-talk is what gives you the pep in your step sometimes to say, hey, girl, get up. You are not what happened to you, because things happen in our lives, and you are not defined by the thing that happened to you. You are not defined by the opinions of others, especially the ones that want to put you down, because they are good criticism that we need to look and to embrace. So the internal monologue is happening, which directs to the external and affect you in your esteem. So look at the way you think so that it wouldn't affect the way you feel and impact the way you behave and show up to the world.
Yes, thank you. Thank you so much for those thoughts, linking there our thoughts, feelings, and behaviors. I love that phrase to close off your conversation with your worth is priceless. And that's really powerful, and in how we should all think of ourselves and our worth. We are all beautiful, and we are all, you know, we all bring something to ourselves, to our families, to our workplace. So those thoughts and those sentiments really, really appreciated, much appreciated. Dr. Arthur, beyond the introductions, I haven't heard from you.
I'm here, I'm soaking it all in and just smiling and nodding along as we go along. I think I could relate to a lot of what has been said. And I like that catchphrase as well too. You know, your worth is priceless, because as ladies in careers, and it doesn't matter your career, today you've met a lot of ladies who are involved in healthcare. But regardless of the career that you may be in, you are worthwhile. You have worth, you have value to whatever organization that you're in. So we just want you to be mindful of that and to remember that.
Great. Yes, so thanks all again. So at this point in time, we'd like to invite our guests for any sort of questions. We'd invite questions at this point in time. You can also feel free to type in the chat. We will respond to all of the questions, comments that are being raised. So we'd like to open the floor now to questions to our panelists. I know a lot has been said, a lot of expressions, a lot of feelings. You know, persons may want to ask anything in particular or just give a general comment to our panelists.
So we aren't seeing any questions in our chat box. So what we're going to remind you to do is that you are free to include any comments, any questions there. And we'll go right on into our second section this evening, because at the end we can always address that we are, in the interest of time, we can keep moving along. So we're going to go into the second section, and our second section is going to look a bit more at menstruation and wellness and how that impacts on ladies. So I'll hand back over to Michelle.
Great, thanks. Thank you very much. So to open our second segment, we're going to invite Dr. Anna Nichols, and she has prepared a spoken word presentation for us, which we would really love to hear at this point in time. Dr. Anna, the floor is yours.
Thank you very much. I'm really honored to be on this forum tonight, and I really do hope that you enjoyed this spoken with piece. I tried to cover all of the most important points and things that women usually experience during menstruation. So I hope you'll enjoy it as much as I did enjoy writing it. Let's get straight down to it. Menstruation. Why is it such a taboo topic for discussion? Aren't women one of God's many creations? So explain to me why there is so much discrimination and unwarranted hesitation on speaking about something that is so vital to females, males, and the public in general. Let's say it out loud, period. It's not as bad as it sounds, but for females, it's serious. At 13, she starts bleeding. She wasn't even prepared for what was coming. Using anything to help, even an old school rag to soak the red. Now she's labeled as being impure to touch because she bled. Will this ridiculous discrimination ever stop? Already ashamed, with her insides running slowly down her legs as she hides her tears and weeps uncontrollably. It makes me angry because of the lack of education. All this could be avoided if we took the time to understand menstruation, a sacred biological process that happens to all females in life, should not be viewed as an omen bestowed on a mother, daughter, or wife. It is because of this women are able to bring new life into the world and should be placed on top of a pedestal to behold. Women are not just mortal creatures that bleed once a month, We are warrior princesses who take care of families, loved ones, and stand on the home front. How dare we be thought of as the inferior sex? When women bleed from 1 month to the next, men say we are like werewolves. Every month we turn into this monster and act in unnatural ways. But if you really took the time to look under the covers, we turn into wolves, wild, strong, and brave. When we bleed, we shed our old skin and rise again. And with each new month, we continue to persevere and become resilient. And yes, having your period makes you very vulnerable, but it allows you as a woman to appreciate the feminine things that make you unbreakable. You are whole, my dear, not broken. And having a period makes you strong, not a burden. Unbearable cramps that we sometimes wish were a dream, only to be awakened in reality with pains that make you scream. For me, it's like a wolf attack from the inside out. By the end, there is so much blood, I am a rifle locked and loaded, waiting for the beast to come out. With each passing month, we become a paranoid mess, asking our colleagues to discreetly inspect the back of our skirt or dress. The male sex may never truly understand what it feels like to bleed, because they experience no pain from carrying their reproductive seed. Some may even say that menstruation is impure and call it gross, but women will always hold up their head and succeed in spite of this so-called curse. As women, we will no longer hide every month that we are in pain or be silent about this natural process that society labeled as a stain. We bleed so that mankind can have a lifelong possibility to reproduce and bring new life into this world comfortably. So as women, feel proud and embrace your most powerful ability, and let no one bring into question your vulnerability, period.
Beautiful.
Thank you.
Thank you very much. And the delivery, the passion, Dr. Anna, thank you so much. And even for your preparing it, thinking up, all of the ideas to put together in that cohesive way to bring the entire experience. As we were, all our women here, we know what that experience was like. I'm seeing in the chat, the poem was beautiful with lots of love in it. So thank you so much again, Dr. Anna.
You're welcome.
As we have the audience here with us as well, we just wanted to have a discussion just to get some of the facts out on the table about menstruation, or what we all grew up as young children, you're seeing your period. And I would like for Dr. Hussein just to give us a little bit of an idea as to why women menstruate and some of the impact it would have on, being at school, being at work, just to give us an overall view from the biological side of things. Dr. Hussein?
Hi again. So yes, with regard to menstruation, it is a process that begins in all young women. The usual time frame for it to start is between 11 and 13 years. This is dependent on different cultures and different countries, but that is our age group in Trinidad and Tobago. Menstruation is important because it is a cycle that a woman goes through. Well, as we would say, becoming a young lady in Trinidad and Tobago. It is where the girl starts to produce an egg, and this is the egg that is necessary for fertilization. If the egg is fertilized, then that will result in a pregnancy. If it is not fertilized, then this will be discarded. The uterus will shed the blood that was there to fertilize the egg, if it would have been fertilized. So it is this blood that the uterus sheds that is known as a period. It happens monthly until the age of menopause. And now periods are still very much taboo in many cultures, and as well in Trinidad and Tobago. It is, for most girls and women, it is associated with PMS, which is part of this discussion. So PMS is premenstrual syndrome, and as the word defines, pre, as in before, menstrual, pre-menstruation, and it's a syndrome. So it's a syndrome that can be classified by having physical effects, emotional effects, as well as behavioral changes, which is, as Anna said, people would go crazy, right? We do not go crazy. It is a natural effect that happens. In most cases, it is associated with anger and irritability as well as hostility. And these are some of the symptoms that may last longest. PMS usually happens about, well, just prior to the period and resolves at the end of menstruation or bleeding. It can be associated with some of the physical effects like bad cramps, as Anna would have said. The wolves are scraping out from the inside. It is true. It can affect the quality of life for the person, including, taking time off work, taking time off school, not being able to function, not being able to maintain relationships with friends, family, with spouses. So yeah, that's part of the physical aspect of menstruation.
Thank you so much for bringing those things to light. And yes, it's still so much taboo. And we would think that this is something that is such a part of our lives, and it happens to every woman. So I'm glad that we were able to share, again, Anna bringing that out in that vocal, poetic style, but it does bring to the fore as to a lot of the emotions that accompany menstruation. So I don't know if any of the panelists would like to even, delve a little more about the emotional side, because we know it happens and we know it's a monthly cycle. But anything we would want to share concerning the emotional aspects of it, especially to young women?
Hello. Hi, good day. Right. So I would just like to add to Dr. Hussein said it wonderfully. But the realistic part of it is that as women, we feel it coming on. You know when you start to get a little bit angrier, when that thing that never used to annoy you starts to annoy you, you're like, it's coming, right? We can feel it coming. And we try our best, I think, especially because we have to pretend like everything is okay, like we go about our normal days. And I think a lot of times we just want to like scream and just be like, no, everything is not okay and I don't feel okay right now. But I think as women, we have that pressure on us to always have it together, because if we don't have it together, people judge us and they be like, oh, right, she's on her period, right? That's the comment that a lot of people like to make. Or even anything about it, sometimes you're not even on your period. Sometimes you actually have a genuine complaint or a genuine concern, but because people associate that emotion with being on your period, it becomes a negative thing. And I hope that we can move in the right direction to kind of get away from that stigma, and that people actually respect us for what we're saying and not just see us as quote unquote emotional every time that we have an actual concern.
Thank you so much, Dr. Esther, for those comments. Definitely. And I'm seeing the heads nodding because we all would have shared some, experience along those lines. Ms. Alborn, anything else to add?
Not at this time, really. I think the members who spoke covered it beautifully, especially with that poem and the contributions from Dr. Hussein. But as I would just say that yes, it is an emotional roller coaster for some persons, especially those who have menstrual cramps, menstrual pain. That becomes very difficult when it is debilitating and when you have to deal with the life of work, and therefore it prohibits you from being able to carry out your activities of daily living. That is when it becomes a problem.
Yes, yes. And I'm going to call on we've adopted Dr. Placid with us this afternoon. So Mrs. Placid, from your experience, do you find that this is still a difficult topic to discuss, even within the family circle or within the schools? Do you still find that level of stigmatism with menstruation?
Definitely. Just this afternoon, coincidentally, I overheard a conversation with a young man who generally spoke about, when he gets married, one of the things that he doesn't want to deal with is the period of his wife. And, we asked, well, why? He's like, no, it's like, I just don't want to mess in that. And, from my NGO side of things, we recently celebrated World's Menstruation Health Day, which is on May 28th. And it was so significant to see people's reaction. So they actually have a day to pause to talk about your period. And, and yes, we do, because your feelings are valid. And yes, we do, because it's part of who we are. And by the way, that poem was excellent. I wish I had met you before. We do, because while I personally, and a bit of self-disclosure, never had any sort of difficult experience and still don't, there are people who, based on the experience they are having, they lose their ability to function. And so I want to say to you, all your feelings are valid. The question is, what are we going to do about it? Because we have been living so long with hearing all the ew and you need to function properly. It's a normal day of work and stuff, but we feel the reality of what we are experiencing. And so you find people also, and as you spoke about the emotional side of things, you find people depressed, and that's the only time of the month they stay in that place of depression, and sometimes it extends beyond the days of the period, and they now have to get other treatments. You find persons, as you said, more angry, they're a little bit more sensitive, and I would want to champion for society. It's not an excuse that we have. The reality is this is part of who we are, and coming with part of who we are, there are some people who experience difficulties. And so I want to champion a cause that, hey, pause to understand what we go through as women in the workplace, in the home, in the schools, and also champion a cause for more education around it, because it's still a taboo topic. Some people can't even go to the stores. I'm talking male as well. They can't even go to the store and pick up a pack of sanitary napkins, or it's a big thing. So as a mother, I share with my boys that someday you would have a girlfriend, a wife, or somebody who will experience this, and let's make this a normal experience for us as female and for the general public.
Yes, thanks so much. And yes, we do see the need for more education around this topic. So it becomes very much normalized, and it becomes very much a part of our everyday experience, that you don't have to have this special sit-down time and you use the different words as if you're afraid of mentioning, some of these terms. So we thank you so much for that. Dr. Hossein, some persons would have asked or we heard about premenstrual dysphoric disorder. Could you just explain what that means?
Right. Sorry, but you all are seeing my video, or yes, is it stuck?
We're seeing you.
Okay,
fine.
Right. So premenstrual dysphoric disorder is, for layman terms, is really an extreme form of PMS that can affect the quality of life more severely than normal PMS would. Some of the symptoms physically are more severe, like the cramps or the amount of bleeding, as well as the emotional changes that the woman would go through, as well as the behavioral changes. It can be classified as a mental health disorder in some categories, and because of this, it can be treated differently than PMS would, resorting to medications in more cases than not.
Okay, thank you. So is it something that we are seeing, or is it a few of the cases, or is it something that is emerging more and more now?
To be honest, in practice and my observations so far, I still think that there is a lot of taboo with PMS, which is the milder form of PMDD, if I may. So people don't really talk about it. They would try to hide it. They will pretend that everything is normal because they don't want to be looked at differently. Being more prominent or not.
Okay. Thanks so much for informing us about these terms and these syndromes and enlightening us in this regard. So, guest panelists, I'd like for us to, I want to turn back to Sandy because I'm not seeing the chat box to indicate if we do have any comments or any questions that the panelists would be able to answer.
A question came across the screen. It wanted important information for persons who have hormonal imbalance. I saw that flit across the screen.
Yes, so we do have some questions in the box, and we're going to start addressing them now. So one of the questions that we have is, menopause is always presented. So even though we didn't quite mention it in the presentation, this one is emerging. Menopause is always presented as a negative experience, but is there any way to induce menopause? Dr. Hussein, that one will go to you first and foremost.
No problem. Inducing menopause, right? That's the question.
Yeah, that's what they're saying. It seems as if, people always see it as something negative, but this person wants to know, can it be induced?
Well, I would want to know why you would want to induce menopause in the first place. It really does depend. There are certain medications and surgery that you can do to induce menopause, but it is not something that we would offer off the bat. We would need to, actually, we would have to have a chat with the person to find out lots of things, including their age, because menopause does come with some risks that can be long-term, including increasing your risk of strokes and heart attacks, as well as osteoporosis. So it's not something that we would induce off the bat unless we really think that it is clinically necessary. But yes, to answer the question, there are methods to induce menopause.
Thank you so much. We also have another comment that came up, and I think it might have been in relation to when we were talking about emotions pertaining to PMS. So someone just commented, I feel emotionally down sometimes because of PCOS. Apparently they suffer from polycystic ovarian syndrome, for those who don't know the abbreviations. And then we have a question from another participant, and they wanted to find out, when should I talk to my daughter about it? And I'm thinking that this is in relation to menstruation. So when do we start to have that conversation with our young ladies? I will place it to both Mrs. Placid and Dr. Hussein at this time.
I'm going to rush you, Ms. Placid. Basically, I would say that I cannot give a fixed time as to when that conversation should be had. It really depends on the emotional maturity of the child, as well as their intellectual ability to understand, right? So it really is child dependent and dependent on the relationship between the mommy, I would assume this is the mommy, as well as the child. So that one you'll kind of have to feel around for. Please help me, Ms. Placid.
Very good. And I was saying that to myself because, again, everybody's context is different. However, use it as an opportunity to explore the body with the child, because we have to know our bodies. And so as parents, and in cases where you're single parent, if it's just daddy, you may want to get somebody to do it, or you can do it if it's just mommy, or if it's both parents. The right time is based on your context, as Dr. Hussein said. Child must be emotionally and intellectually can manage, having that conversation. But I would say, in addition to that, I'm thinking now, it have to be done before you start seeing some sort of, before something happened, But so you time it, and of course, you I don't know if any young woman is ready to hear about the menstruation. So you really use it as an opportunity to explore the body with the child and look at your context, understand the emotional state of the child, as Dr. Hussein said, and the intellectual. And of course, you balance those worlds and give it a go. And make it a fun conversation, please. I'm going to add that. Please make it. I think when we talk about our period, we scare our girls about this thing, and they expecting, you know, to be in bed and to have all this trauma. I will tell you this. I got that type of conversation and nothing happened. So I was looking for a belly pain and I didn't have none. And then I was upset because my friend stayed home from school because she have a belly pain and I'm not getting a belly pain. So I started to bring on my own stomach pain and looking for things. So be mindful. Our bodies are different and we all will experience different things.
Great, thank you. Staying on that same theme, we have two other questions, and one, well, they're related in a sense. Good night. Can you please provide information for women who have imbalance in hormones causing irregular periods? That's the first part, and the next part would be, is it normal to have spotting between periods? So Dr. Hussein, you are in the hot seat tonight.
Right. So important information for women having imbalanced hormones causing irregular periods. There can be lots of causes why the hormones are imbalanced. I would say that you would need to take a proper history and examination before you could move forward. It may involve doing some investigations, but I really can't answer that question off the bat or roundabout because there can be a lot of different causes. Yeah. I know that's not very helpful, but I think that you need to be properly assessed and more, information acquired.
And we agree totally with you. Go on.
Right. And for the second part, hi, good night. Is it normal to have spotting between periods? No, that is not normal. And that also should be checked out by a gynecologist because it will involve, again, a proper examination. And that would involve a pelvic examination or intimate examination, right? But I would advise in the meantime that you probably should get a pap smear done if one was not done recently, and that will help speed up the process of investigation.
Thank you, Dr. Hussein. And for those who may have joined our presentation late, at the beginning we shared with you how you can access services within the Southwest Regional Health Authority. We all should be acquainted with our local health centers. We have 31 health centers and then 3 district health facilities, which also have a primary care element to it. So you can go to your nearest health center, you can indicate that you have a problem, and then you'll be given guidance there so that you can then be streamlined. Even if it is that they think you need to see a gynecologist, they can then tell you how you can access that care as well. So we're on to our next question. And this one goes like this. As women with successful careers, do you see a mentorship program as a viable program within the workplace for young professional entrants? I can pose that one to any one of our panelists, but I'd like to hear persons like Mrs. Thomas Alborn, Wayne, as well as Michelle.
Could you repeat the question, Dr. Arthur?
As women with successful careers, do you see a mentorship program as a viable program within the workplace for young professional entrants?
A mentorship program?
Yes, a mentorship program.
Yes, I do. It's important to have succession planning and you want to have that, how you call it, transference of your institutional knowledge so that those coming up, can then pick up the mantle, so to speak. So yes, you need to have a mentorship program where you can groom your young leaders to lead.
Yeah, and Sandy, I concur with Ms. Elbon's comments, and it's always good because you become like a living example, rather than what persons may see or say, or they may see persons celebrities and these other persons as mentors, but rather when you have this within the workplace and they see you as an example, you're working, you share that knowledge transfer. You're with the team and you're down in the trenches, as it were. It's good, and they're able to emulate some of those qualities and those values. So mentorship programs are good, and also grooming young leaders. It's sort of, it shouldn't be like separate as a program, but it should be part of your focus as a manager, as a leader, as a head of a department, where you train and you impart, certain values and organizational skills to your staff. So while a formal program to the organization is welcomed and it has value, it's also on the owners, as leaders to share and to give back as well.
Thank you so much. Anyone else would like to share? Okay. Our next question is, does having fibroids increase PMS symptoms? Dr. Hussein?
Right, so yes, I'll take that one. PMS is related to ovulation, which is releasing the egg or not, right? So fibroids do not affect ovulation in any way. So it's unlikely that having fibroids, it would increase your PMS symptoms.
Thank you very much. And our next question, can pap smears be done on an individual who is not sexually active? And I'll start off this one, and then Dr. Hussein can always jump in and supplement as needed.
Sure.
So pap smears are done to screen for cervical cancer. It's a good screening tool because it can actually pick up abnormal cells on the surface before they become cancerous. So there are things we can do to prevent cancers. More than 90% of cancers of the cervix, we have learned over time, are caused by human papillomavirus, which is probably one of the most common sexually transmitted infections. So generally, when persons are not sexually active, we do not recommend pap smears, since their risk for cervical cancer is going to be very, 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 very low. And also, because it's an intimate examination, we would not impose that kind of examination on anyone who would not have been sexually active prior.
Yes, and I agree 100% with Dr. Atta. Though it can be physically done, we do not recommend it for physical reasons and because it may be deemed unnecessary, as a person will have no risk for developing cervical cancer and not sexually active.
Right, so that brings us to the end of our questions as I am seeing them at this point in time. And we were really happy that you joined in and you posed your questions to us and you shared with us, you made your comments. We do hope that it was meaningful and that you learned something new tonight. Once again, thanks to all of our panelists who would have participated, and we really did enjoy that poem. It was lovely. think we're probably going to have to get that one framed and posted somewhere. We're coming to the end of our program this evening, but we did want to leave you with some information moving forward in the future. So if this is the first time you're joining us for one of these programs, you can look out for us the last Tuesday of every month. This one came a little late. We had to delay it. Last week, Tuesday, everyone was in preparation for Storm Bonnie that didn't materialize until after it passed us, thank God. But you can look out on our Facebook pages and Instagram platforms for information on sessions like this where we come and we interact with you. We also want to remind you that this Saturday, the 9th of July, today was about women, but on Saturday, we're going to switch onto the other gender and we're going to have a special outreach program for the men in our communities, and it's going to be held at the San Fernando Teaching Hospital on level 3. Yes, the 9th of July is a Saturday, and yes, we, your healthcare providers, will be available for all our men who would like to come in, join us. We have a comprehensive package for them that will be provided on that day, and we encourage our men. We know that oftentimes men don't seek healthcare, and unfortunately, you wouldn't believe it, their life expectancy is less than that of women. So we want to change that narrative. We want to change that story. So you can look out. Again, these posters are posted on our social media handles. So just stay informed, keep in touch with us, and see what's new and what's coming up. We wish you all a pleasant evening. Unlike times before, we don't have to say drive safely because you've been able to do it in the comfort of your homes. And we look forward to joining in with you again in the future. Thank you. Have a good evening.
Bye, everyone. Take care. Great evening.
Goodbye, everyone. Have a pleasant evening.
Yes.
Thank you, everyone. Bye.
Bye.